So hi again. I, as I was telling you guys earlier, I am in Colombia, and I am about to have surgery on my body and some things to my face. Now, there are some essential things that you need to consider before getting surgery, and one of them is having realistic goals, knowing what you want opposed to what you see someone else have and think that you can have that. Why the goals need to be realistic? So specifically, you want to get a tummy tuck. You want to look good. That's not a specific uh, reason. The specific reason is I want my tummy to be flat again. I want my muscles in my abdomen area. I want them tightened. I want the fat removed. And then I want you to take the excess and tuck it. That's why they call it nip and tuck. um, so that's one area. I have cellulite on my legs. And granted, some people are okay with it. I'm not. I want my legs to be smooth again, and um, I have a little more hips than I want. I want it taken down. Just a tad bit, not much. Enough to make a difference, though. Um, I want my breasts, which undoubtedly my breasts were done 27 years ago. So I want them removed and replaced. Now, why so long? Well, they hadn't caused me any problem, and not that they're causing me any problem now. I get mammograms every year. I get a special type of mammogram because they really can't be flattened. So I get a mammogram every year, and everything is fine. I was just waiting for the right time, and excuse me, my eyes are very itchy. I am actually developing some type of eye allergy. But anyway, so I want my breast replaced. Now I had saline in the beginning, so now I want a silicone. I want gummy bears, is what they're calling them. They're soft and squishy, is what I want. I am going to get a little lift, not a lift where I am, where it's all the way up here. I just want them a little lift. Um, and I'm getting the 360 liposuction, which means they are going to do my whole entire body, my back, my arms, um, and of course, my legs and everything. Now, the doctor feels that although I have a great butt, she says, well, just a little something. I told her, please don't screw up my butt because my butt is nice. I need to sit this butt on someone's face. Not someone, but a person. It needs to be able to sit on there nicely and where he would absolutely love. Okay. Um, I do want my neck to be tightened up, my face tightened up. Now, I had an accident over 20 years ago with my nose, and the doctor was not a cosmetic surgeon. So he fixed my broken nose. And once he wrapped it up, though, once we took the bandages off, one nostril is round and the other one is slanted, which I've dealt with it for over 20 years. I'm done with it. I want my nose to be, um, both nostrils to be the same. She wants to do my eyes. I want an eyebrow lift. So, but the changes are so subtle, you guys, you may not even notice it. because basically I'm not doing it for you. I'm doing it for me. When I look in the mirror, I want to see a certain look. Now, the men that I have been dealing with, and I'm not saying all at once, um, they're 10 years younger. They look really good for their age, too. I look just as young or not younger than they are. So, you know, that, I don't know if that's a factor. I don't think so. But, older men are attracted to me. Younger than 10 years are attracted to me as well. I don't really want anyone too much younger than I am. 10, 12, maybe. I like 10. So, but that's not a factor in my decision. My decision came about, it's because I want to look, I want my body to look as youthful as I feel. And I feel absolutely wonderful. I really do. I'm healthy. I've gotten the ECGs, the echocardiogram, the breast, uh, what do you call them? Um, Mammograms, and the doctor said everything is fine. Now, some of the things that I realized in your planning and what you want, um, maybe you may not even know. So I think that that's something that you need to sit down and look up, look at other women saying, well, maybe I would like this or maybe I would like that. Or look at your own body, just stand in the mirror and you see the imperfections, um, and you could see what it is that you want. Period. It's not that difficult, um, but there are some basic things. That's just a number one. There are, I would say, about 9 or 10. So that's the first one. I'll be back with some additional information on your planning, and then we're going to move to number two. Okay?